Okay, welcome. For those, I would suppose you both know me now. My name is Bernard Rubenstein. I am the Managing Director of Franchise Benefit Solutions. I will go over our program, and then if you want to hold your questions towards the end, it'd probably be best. And then I have a short presentation, probably about a 10-minute presentation, and then we can go over questions at the towards the end. A little background of Franchise Benefit Solutions. We have over 35 years of experience specializing in customized benefit programs to the franchise community. Our firm provides exclusive plan designs to franchisees across the United States. Over the years, we've had the privilege of partnering with Valpak, Comfort Care, Grocery Outlet, the Joint Chiropractic, and Jenny Craig, amongst others. In recent years, the insurance industry has witnessed many changes. Our clients are aware of the changes going on, and many have expressed an interest in offering alternative benefit plans to help recruit and retain employees, like you said. So what makes us different? We have solid understanding of the franchise industry. We focus on building a benefit strategy and developing long-term relationships. We offer training and support for prospective franchisees when you bring them in. We offer an online quoting portal, which allows the ability for franchisees to obtain instant quotes from multiple insurance carriers. And we offer a branded webpage linked to your corporate site outlining products and services available, which we already have set up for you. Our advantages: we offer affordable group plans and rates with guaranteed acceptance and no waiting periods. Plans and rates are the same no matter where your franchisees are located. If you have a franchisee in Florida, Michigan, Washington, or California, the plans and rates are the same. There are no participation or contribution requirements. Plans can be employer paid, standalone, voluntary, packaged together through payroll deduction. Franchisees choose the benefits they want to offer for their employees, and then the employees enroll online through our online portal. Our program portfolio includes medical, dental, vision, life insurance, accident, critical illness, hospital indemnity, telemedicine, prescription drugs, and short-term disability. And like I said, plans can be employer paid, standalone, voluntary, or packaged together through convenient payroll deduction. We offer 3 health plan options: individual and families health plans, comprehensive group health, and voluntary group health. For those employers that don't want to offer a group plan for their employees, but are looking for an individual health plan for themselves or their family, we offer an online quoting portal they can view at their own convenience. A lot of times, groups or the employers have work to do during the day and they just don't have the time to speak to us. So the advantage of going through our online portal is they can do it at their own convenience later in the evening. And then if they have any questions, then they can get a hold of us. Once they input their personal information, they can compare affordable health plans from different carriers, find out if they qualify for financial help or a subsidy, through the marketplace. They can view benefits at a glance, view local providers, and they can even apply online or download enrollment forms. If a franchisee is considering their group options, we can help them make the right decision that best meets their healthcare needs, their business, and their employees. Group plans are based on the demographics of their company, along with their employee and dependent ages. So we would need a census in order to provide them with a group plan. We offer ACA and non-ACA compliant plans. ACA compliant plans are community rated, while non-ACA plans are based on the demographics and the medical history of their employees. So a group can be termed or not quoted, or they could be rated based on the health history of that group. That's under the non-ACA plans. Those are the plans that were available before the Obamacare came in 2010. So the plans that we enrolled prior were the non-ACA compliant plans. So they're starting to make their way back under a different type of underwriting process. So the ACA plans require a minimum of 2 enrolled employees and will accept eligible waivers such as Medicare, Medicaid, Marketplace, spousal coverage, or other group plans. So if a group comes to us and has 15 employees and half of them have coverage elsewhere, then though that half is not considered as eligible. So it makes it better for us to enroll that group. Non-ACA plans may require a minimum of 5 enrolled employees and will not accept any waivers. For example, if a franchisee has 15 employees, a minimum of 7 employees are required. These are the plans that's prior to the Marketplace ones. So far, I've covered 2 of our 3 healthcare options: individual and family and comprehensive group health plans. Our third and most popular option is our low-cost voluntary group health plans, similar to an association health plan. Our voluntary MEC and limited medical plans are all about easy, low hurdle access to the healthcare system, otherwise unattainable for many employees. The basic MEC plan, which you can see here on the screen, the basic MEC, covers preventative services only, while the MEC Plus, the next one, covers preventative services, primary care, and specialist visits, along with urgent care, lab and x-ray service, and generic prescription drugs. The premium MEC, which is the plan over, and the super MEC plans include value-added benefits, which is a cash benefit payout to the employee to help avoid a financial crisis. Member pay copays, which is the MEC plans here. There is no balance bill for those covered services, similar to a comprehensive plan, which you're probably enrolled in. Members must use a PHCS network provider and excludes out-of-network benefits. So what you see here is the top portion here is similar to a comprehensive plan. What this does not cover is inpatient, outpatient, or prescription drugs. An average cost for a group plan, I'm going to say pick Texas, is around $400 to $700 a month for a comprehensive plan. I think we enrolled a group in Texas last month. Their individual premium was around $700 for a comprehensive through United Healthcare. This type program, let's say for a MEC Plus by itself, is $109. So big difference. So what we find is we probably write 80 to 90% of our business is one of these MEC plans, because employers can't afford a $700 premium anymore. So they offer this. Now we do offer a hospital confinement plan, which I'll go over in a minute, that we find employers will contribute towards, let's say, the MEC Plus plan here. And then they offer the hospital confinement as a voluntary benefit. So that's probably our biggest type of enrollment. And again, healthcare costs are just going out of whack right now. So a lot of employers, this is what they can afford. So our basic MEC, the MEC Plus, premium, and super MEC all include 100% covered for wellness exam. Now this is the plans satisfy the ACA and the state individual mandates. So, like California, they have a state mandate similar to the ACA where they have to have healthcare. So this, the MEC plans here do satisfy the ACA. So the wellness plan covers wellness exam, immunizations, any type of screening, blood pressure, diabetes, cholesterol. It's an average physical. You go into the doctor, get a physical, covered 100%. Flu shots, colonoscopy, and mammography screening, all covered at 100%. The value added benefits is, as you can tell here, is the premium M and the super MEC. We've added a package which is through Aflac, but it's paid to the employee. So it gives them a little extra limited coverage, which is paid to the employee, and they can use it to help reduce any of the out-of-pocket expenses. So again, it's not a lot, it's just something, but we do find it that a lot of employers will offer the basic MEC or the MEC plus, and then allow the employees to upgrade to one of the other packages. There is no employer participation, so the employer doesn't have to participate in cost at all. And there's no contribution required. So again, plans are the same, rates are the same in all 50 states. Okay. Our limited medical plan, while not comprehensive like major medical plans, help defray some of the out-of-pocket costs associated with major medical plans. Members can visit any provider. However, if they use a network provider, their out-of-pocket expenses will be reduced. For instance, as you can see here, the primary care physician, it'll pay $60 a day. So if the cost, let's say, is $120, this will pay $60. This one has a balanced bill, which means the employee or member is responsible for the other $60. However, if they visit a PPO provider and it's discounted, instead of $120, it's discounted at $80, then the employer member is responsible for the other $20. Okay. This plan offers a little more than the MEC plan, whereas it covers outpatient surgery, anesthesia, hospital emergency. It doesn't include urgent care, hospital room and board. It'll pay $300 per day, hospital admission for a specified condition, and then prescription drugs. The cost on this plan is around $93 a month. So you can see, again, a lot of employers may offer this, but there's two things that we caution them on. One is could be balanced bill, and the other one, it's paid to the employee. However, the employee can assign it to the provider. Because if you go see your doctor, they always have you sign a form before you go and visit the doctor. Basically, it says that the benefits from the carrier are going to be paid to them. This would be the same thing. So they can assign it, but if they don't, it's paid to the employee. So the difference between this and the MEC is mainly the MEC plan. There's no balance bill, simple copays, where the limited, there is a balance bill, or there could be a balance bill. We also offer various voluntary programs. Here we offer dental. We offer 4 plans. Coverage maximums are from 1,000 to 3,000. They can choose any dentist they want to visit. The advantage of our program is there's no waiting periods. Whereas if you enroll in a dental plan, let's say today, you will have a 12-month waiting period for some basic and for most major services. Our plan does not have no waiting period. So if you join today, you start from day 1, no waiting period. Vision, we offer 4 plans, 2 from VSP and 2 from IMED. All 4 plans have a $10 eye exam and a $25 lens frames copay. The difference between the plans are each plan is going to have a 12-month eye exam visit, whereas the glasses could have a 12 or 24-month difference here. Life insurance, we offer 2 types of plans. Voluntary or a group plan, employer pay for $10,000, and a voluntary plan, employee pay, not employer, just employee. Employee can purchase up to $150,000 for themselves, $50,000 for their spouse, and children $10,000. Guaranteed issue, the plans are up to $150,000, $50,000, and $10,000. Now the $10,000 doesn't matter how many children, it's still one price for the children. No medical questions, so we will take everyone at the time of enrollment. So if they decide to enroll a year later, then there will be health questions. Telemedicine. This is where, let's say you have one of your franchisees employees that are at work They get something in their eye, but they can't go to the doctor because they have other appointments that they need to get to. They can call the doctor, provide them with their symptoms. The doctor will give them a diagnosis and even call in a prescription. What's good about this is they can connect by phone, video, or by app. I've seen where my son had something in his eye. He uploaded a picture and the doctor looked at it and gave him a diagnosis and even called in a prescription for him. So this covers up to 5 members in a family. And I think the cost is around $10 a month for the family. Accident critical illness through Aflac. For the accident, benefits are for inpatient and outpatient treatment of a covered accident. There's more than 50 benefits covered on or off the job. It'll also pay, in addition to benefits for treatment, it'll pay for lump sum payments for fractures or dislocations. Guaranteed issue, there's no underwriting, there's no health questions, and our plans and rates haven't changed since 2014. Critical illness, the plan pays a lump sum upon diagnosis of 20 covered illnesses. So let's say someone's diagnosed for cancer. The plan will pay as soon as they're diagnosed. The benefit amounts, $20,000 for the employee and $10,000 for the spouse. Dependent children covered for free at 25% of the primary insured amount. And again, there's no health questions, and it also includes a wellness exam. Hospital indemnity. So this is the hospital confinement plan that I mentioned that employers include with the MEC plans. Covers both injuries and sickness. So we offer 2 plans, a medium and a high plan. Admission and per day hospital confinement benefits are included. Outpatient medical treatment received in a hospital emergency room or physician's office. Surgery and anesthesia, diagnostic testing, prescription drugs are also covered as a benefit on the plan. So we do find when an employer is offering the MEC plans, they will include the hospital indemnity. Short-term disability. We offer 3 benefit amounts. Plan will pay up to 60% of the benefit amount. Plan duration is up to 6 months. There is a 14-day waiting period before the benefits begin for accident and sickness. And we offer a discount prescription mail order, which is free to the operators, the franchisees, and their employees. That's basically 80% on prescription medication for a 90-day supply. So if they have a 90-day supply, we offer the free discount prescription. It's through Canadian Med Store. It does not cover liquid prescriptions. Okay. Our services include consolidated billing. So what we do is with all the benefits that we offer, we'll send a single invoice to the franchisee, and then they pay us through ACH or credit card, or if they want to send in a payment. But we probably have 90% of our clients pay either online through ACH or credit card. We offer online HR services, Section 125 premium only plan, which allows the employer to deduct premiums, and we offer COBRA administration. So how does our benefits enrollment platform, from the time that we speak to one of your franchisees to the time of enrollment? Our platform, our enrollment platform includes 4 steps from the initial contact through the enrollment. Step 1 is discovery. The first step is to identify the employer's objectives of offering benefits that reflect both the employer and the employee's needs and budget. We will gather their group information, discuss their employer's goals, benefit options, and budget. Step 2 is an analysis. So this is after we obtain the group information. We will obtain quotes for them. It's important for them to be strategic when deciding what to offer. We will review benefit options, cost, and help set up a benefits program that will help the employer attract and retain employees. So we'll go over step by step with them, and depending on what they're looking for and what plans that we would suggest for them to offer. Step 3 is the communication. The communication strategy is a critical component to the benefits planning and management. We will develop a easy to understand benefits communication for employers to share with their employees. We will provide them with an employee enrollment guide that they can hand out to their employees prior to the online enrollment. Then we build out the online enrollment platform, which is step 4. Our online enrollment helps employers spend less time collecting and reviewing forms and communicating benefit details. For the employees, they can select the benefit options best suited to their specific needs. So we would send the employee login information. Once they log in, they complete their profile, and then they go through the enrollment process. And once they're done and they've signed their application or their form, then we get the notice, and then we enroll them through the specific plans that they've requested. The employer can download whatever reports they may be looking for from the enrollment portal, including a payroll deduction report, which they can then forward it over to their payroll providers. So whatever they need, we can help them set up, and they can obtain through our online portal. So looking ahead to 2023, and there's a reason I'm bringing this up, because there's 2 types of open enrollment. One is what you're familiar is the marketplace, which is in October through December. But there's also what's called a group special enrollment. This is where most brokers don't want to, or don't know about this, or don't want to offer it to groups because they don't really make commission off of this, and the insurance carrier don't want you to know about it because there's risk to only having 2 employees as part of the group. So most groups don't even know about this. It's a 30-day window from November 15th through December 15th. So under the ACA, carriers are required to offer an annual group special enrollment period to employers who do not meet participation or contribution requirements. So there, again, it's a 30-day window to enroll a group plan. There's no participation or contribution requirements. So we can enroll a group with, let's say, the Blues or United Healthcare. It's from December 15th through, it's from November 15th through December 15th for a January 1st effective date. All we need is 2 full-time employees, 2 W-2 employees. One could be the employer and his spouse, and one would have to be another employee. So we find a lot of times employers will have one of their dependent children as an employee. They can do that. So we find a lot of employers will set up a management plan by putting in a comprehensive group plan at the time of the special enrollment. We enroll most of our business during this 30-day window, believe it or not. So this is our accounting season. So again, November 15th through December 15th, we do try to get out as much information regarding this special enrollment period. I know right now we're in May, but by the time we turn around, we're already starting to look forward to the open enrollment. We're trying to work on plans to have in motion for the open enrollment. So what are the most popular solutions to help hire and retain employees? And this is what we find as the most popular. Package 1, like I've been talking about, is offer a dual MEC plan. The employer contributes towards the employee only cost. So if it's a $100 plan, generally we find the employer will contribute, let's say, half of it. So $50 towards the employee only. The employee contributes the other $50, plus any dependent cost and if they decide to buy up to a better plan. Then the employer offers voluntary benefits at 100% employee pay, where the employer does not contribute, for the dental, vision, voluntary life, telemedicine, accident, hospital confinement, and the short-term disability. You see where I have the hospital confinement in bold. Again, this is the hospital confinement that we find the employer tries to package with the MEC plan. And generally, we find the employer will, when they speak to an employee about the MEC plan, they'll include the hospital confinement as part of the discussion. Package 2 is through the special enrollment period, which I just explained. The employer enrolls in a management-only group health plan through the special enrollment period. The employer contributes 100% for ownership and 50% for management. And then they offer the voluntary benefits at 100% employee pay. Package 3, the employer enrolls in a comprehensive group plan, and it doesn't matter what time of the year. The employer offers dual medical option. So let's say United Healthcare, they'll pick 2 plans, one with, let's say, a bronze, the low plan, and one could be a gold or silver. They will contribute towards the bronze plan, 50% of the employee cost, and then the employee pays the balance plus any dependent or buy-up plan. Then the employer offers voluntary benefits, again, 100% employee pay. Package 4, the employer does not contribute at all and offers our voluntary benefits at 100% employee pay. So you can see you have 4 packages here. What we generally see the most is package 1 and package 4. Now, our biggest authority brands clientele that we probably work with is the cleaning authority. And generally we find they'll either go with package 1 or package 4.
Okay. So question, on these packages, do they have to get it packaged the way that you already have it, or can they kind of mix and match some of these? Like if they wanted to do package 2 for the ownership and for management, but they wanted to do package 1 for the employees, is that something they could do?
Yes, definitely. I'm just showing you here what we find as the most popular way of setting up plans, but it's pick and choose.
Gotcha.
Whatever they want to set up, they can do. We have a branded page. I'm not sure if you've been to our site that we set up for Authority Brands, but it outlines all the plans that are available to your franchisees. And as you can see here, it's abfranchisebenefits.com. That's pretty much it for the program. I hope it kind of explains everything that we offer. You have any questions?
I have a quick question. Ashley, do you want to go first though? I saw you on mute.
No, I actually don't have any questions. I thought this was pretty informative, but you always have the best questions, Chris, so please go ahead.
First of all, how would you guys compare yourself to somebody like Ashton Benefits? You're both brokers, and you're both brokers for, you know, benefits for the franchisees. Is there something that would drive people your direction as opposed to Ashton Benefits, or you think that you're similar in those respects?
Okay, I don't know anything about is it Ashley Benefits? Is that what you said?
Ashton.
Ashton, I don't know anything about them. We seem to have franchisors reaching out to us all the time. The advantage of our program is they can pick and choose how they want to set it up. We have our own program already set up. It's an association type program that's already set up. So we don't have any health questions, no waiting periods, no nothing. They can set it up any way they want. So our rates are, from what I've seen out there in the different MEC plans, are affordable. Again, it's pick and choose however they want to set up. A lot of plans though that we find, and it may be the same with the vendor that you're talking about, they have to have a minimum of employees. we go down to one.
Okay.
So those
That's-
are our advantages.
That's useful because we do have a few that are just starting out, but they're already considering medical benefits. And if one employee is the minimum that you guys are looking for, then that's perfect.
Yeah, we've spoken with Mosquito Squad.
Yes.
I think we have several of them, and I know those are minimal employees. And we may even have one of them that may just have the owner or the franchisee as enrolled.
Okay, perfect. Now, we do have a full, or we have an insurance team set up that kind of does this and, you know, sends the information over to the vendors and make sure that everything kind of goes through and they get the quotes back the right way. As far as how you guys want the information, is there anything in particular, or do you just want to be connected to the franchisee and say, you know, do your own presentation and all of that from there?
You know what, we have set up, Kevin, are you there?
Yep, I'm here.
We have set up webinars where we've set up, if I remember correct, we set up one webinar for all the brands.
Yep, it's loaded on our Alliance page, so they can go review it directly.
And then we've also offered brand webinars. So, you know, if you got 8 brands, we're willing to do 8 different webinars. And then we could record it, and then you can upload it to each of the brands. I assume there's pages for each of the brands, so we could do that too. I know we also received the directory.
Okay.
Now, does that include all 8 brands, Kevin?
No, that is just the Clockwork for you. We're still only allowed to give that information out. We're hoping, again, something we've been working on for months, to try and either get more added to that or be able to get you guys into the leadership of the other groups, but it's still just the Clockwork brands at this point.
Okay. We are working on different flyers that we could send to you. I know we're working on one as we speak. We're working on one that we could provide you, and you can get out to your franchisees. The
Okay.
other thing too, we do have a newsletter that we use for the directory. I'm not sure what's the best way of the newsletter reaching the other franchisees, the balance. But
So once we've generated some interest on our end and they've told us, hey, we're looking to get benefits, do you guys prefer for us to send you like an email saying, hey, this person is interested? The franchisee, not like the brand, but just the franchisee themselves. Do you prefer an email, or would you prefer them to go directly to the website, which you said was abfranchisebenefits.com?
You know what? A lot of times, if you tell them to go to the website, you probably get half of them to actually do it.
Right.
I would probably, if you want to send us the email, and that way we could reach out to them right away. And then also let them know the website is available to them.
Okay.
But that way we keep track of, you know, franchisees that are interested in, and we'll reach out to them. So it's, you know, we'll take the lead from you, and we'll reach out to them, and then we'll let you know that we've spoken with them.
And Chris, just on that note, based on your last question, the insurance panel is just for the business insurances. Doesn't have anything to do with the health insurances that FBS or can handle, which is why I wanted to introduce you guys to these, so you see the other side. So that insurance panel just does the casualty, the vehicle, and then that side.
Okay, that is good to know, because I believe I've been presenting it wrong. Then if
Yeah.
John's not handling the benefits portion, then that's good to know.
Yeah.
Then it makes it probably better for you to send us who to contact.
Perfect. And then which email should we send it to? Do we have your email directly, Bernard, or is it somebody else?
Send it to me and then I will forward it to one of our reps. So that way I'll be the main contact.
Bernard and Michael are both listed on the website, so either one.
Yeah.
Okay, perfect.
Do you
Awesome,
have
that's all of
my,
my questions.
Chris, do you have my email?
I do. I've got you at, looks like B Rubenstein at franchisebenefitsusa.com.
Perfect.
Ashley, anything I missed?
Yeah, so just to finish up that note, Bernard, you had mentioned that, you'll take the lead from us and, speak to that franchise owner individually. Would you be able to give us a recap of how that conversation went? Like, are they going to sign up? Something like that, just so that we can keep track of their adoption of services as well.
We do, and Kevin, you can jump in on this one too. We do provide Kevin or corporate a report on a quarterly basis on the status of the groups that have reached out to us and where it's at. But with our database, we can also run a report. We're starting to provide the information a little quicker than we have in the past, but we could provide information on who's reached out to us and the status. And then if something comes up, you can let us know and we'll get back to you.
Okay, that works.
That report that you're currently providing to Kevin, you said was quarterly. Is it possible to bump that up to monthly instead of quarterly?
Yes.
Okay, that would be perfect.
If Chris and I could be included, that would be awesome too.
If not, we'll get it from Kevin.
Yeah.
Yeah, I'll forward it over to you guys so you guys
You know
can
what,
keep
I
an
was
eye
gonna
on
say,
it.
how
Yeah.
about if I send it to Kevin and he can?
Yeah, I'll get it to you
Yeah,
guys.
that works.
and Yeah, when there's stuff to follow on, because it's usually just the rebate portion of it. So
Gotcha.
that
Well,
AR
it's gonna
needs
be
as well.
it'd be a different report, Kevin.
Yeah.
So
Okay.
on the status report. Can we talk about marketing, forward? What's the, we'll have a flyer to send out to you, but when Kevin, do you want, I'll send the flyer over to you again, and you can distribute it to the different brands. And then can we talk about setting up a webinar or, try to move forward in, I know you've had new franchisees, we've got the new brands and whatnot. What is your thought on that?
As we get that one pager out and we start getting interest from those other brands, that's when the key time to set up a webinar would be. I don't want to set anything up without us, going through Richard and getting access to those leadership teams to say, hey, this is something we want our franchise to do. Like I said, they're more of the top down, where the Clockwork brands that we give you guys can just go attack and say, hey, we're here if you need us. We're going to set up this webinar, please register. Where the other ones, we kind of have to go to the leadership and say, hey, we want to set up this program and get your teams involved. So as this starts to pick up steam with Chris and Ashley and Richard, then we can go to that next step. I don't want to schedule anything before and then have no one show up.
Okay. Now,
Yeah, in the meantime, the marketing will be much more guerrilla marketing through Ashley and I. We'll do more of the sending out emails, making sure people are aware that Franchise Benefit Solutions is a partner of ours. So any information that you can get us, like the one pager that you were talking about, would be helpful for getting more groundswell on interest and whatnot.
And if you have any like testimonials or anything like that, those go a long way within our franchises. If they see other owners have had success and used you, put a blurb about that in there. That has a lot more weight than us coming through.
Okay.
Right.
Now, so when I send you the marketing flyer, is this, and we send out, let's say decide to send it out with the directory that we have now, what you would be sending out would be different brands, or would it be the same?
Different. If you're trying to send it to the full directory that you already have, you're just going to get the Clockwork brands.
Got it. Okay.
Yeah, so that is your Mr. Sparky, your 1 hour, your Benjamin Franklin, and I'm not sure if Stop is on there yet. They may have been added. But then Chris and Ashley have America's Swimming Pool, Mosquito Squad, Monster Tree, Home Watch Caregivers, Cleaning Authority, Wolfies and Color World are 2 new ones that we just added. So they have access, like I said, that other 8 brands. So
Got
Yeah.
it. Okay, perfect.
We have about 600 franchise owners a piece, so we've got plenty of people that we
Yeah.
can send over to you.
Okay, perfect.
all right,
Okay.
guys, I have to jump. I got a 10:15 I have to jump on. So you guys can continue, and Bernard, I'll look for those sheets and get them over to everyone.
All right, Kevin.
Cool. Thanks, guys.
Kevin,
You have
All
any-
right, thank you, everybody. Those are my questions. Ashley, did you have anything else?
nope, not right now. I think I'm good.
Well, I really appreciate you taking time out and joining. Unless you have any other questions, I'm good.
Okay, perfect. I'll just keep an eye out for the one pager that you're sending over the marketing flyer and we'll start from there.
Okay.
Yeah.
I appreciate it. Have a good afternoon or morning, wherever you're located.
Thank you.
Okay,
Thanks so much, Bernard.
okay, take care.
Take care. Bye-bye.